Hi, I'm Benjamin Hill with Mission Physical Therapy. I'd like to talk with you a little bit today about the source of your pain versus the source of your problem. There's a lot of talk among doctors and physical therapists, chiropractors, and massage therapists about getting to the source of your pain. This can be more challenging than it sounds. You can hurt somewhere and point to it and feel like you've got to the source of your pain. And maybe you get on Google and ask Dr. Google, based on your symptoms, what you've got, and you may have an answer as far as a name goes, some sort of itis, right? Tendonitis, tennis elbow, whatever it may be. But the problem is that the source of your pain and the source of your problem can be two different things. You want to find the source of your problem, not the source of your pain. And it may sound like I'm talking about semantics here a little bit, but basically the source of orthopedic pain is always the increased pressure or chemical irritation of inflammation on that area that's being irritated or broken down. And if you focus on the symptoms, you in your treatment, you may be disappointed in only having short-term relief. And this may be true as well. We think symptom-focused care and we think hot packs and cold packs, medication, injections, things like that. But this may be true for a surgery as well. It may have been identified on an MRI that you had a bulging disc, or they may identify the particular nerve that's bothering you and do some radiofrequency ablation. But whether you do some surgery to trim up that disc and have a discectomy, or the radiofrequency ablation or other interventions, you may be doing something that reduces the pain for a time, but we're not necessarily taking care of what actually broke those structures down in the first place. Or we may not be correct. I've had some patients that have been disappointed in having some of those treatments done and yet still being in pain afterwards. And there's a lot of attention internationally on this problem. Because it's just not as simple as we might think. Considering a study published in a medical journal, in the Journal of Radiology in 1998, researchers took an MRI of about 3,000 people without back pain. So they did not have any back pain. And there have been some studies that have been conducted similar to this since, both for the back as well as the neck, different areas of the spine. But in this particular study, again, 3,000 people, no back pain. They took these images, sent them to radiologists who read them, and these radiologists did not know that these people were pain-free, but they were asked to point out those abnormalities that they found. And they found that 56% of the subjects had annular tears, meaning around the outside of the disc, those layers were tearing. High intensity zones in 47% of subjects. When they used some contrast to enhance the MRIs, they found that 96% of those subjects actually had annular tears, not just 56. And so you might take this into consideration when you have an MRI. If you did not have any contrast, they may not be able to see some things. They found disc protrusions in 33% without contrast, but when they used contrast, they found that 85% of them had disc protrusions. Disc bulges in 81%, mild to moderate disc degeneration in 72% of subjects. And they found severe disc degeneration or arthritis in 55% of these subjects. And again, none of these people had any complaint of back pain. So I'm sure these researchers were scratching their heads a little bit, wondering, asking a few questions, because obviously the pathology that they found, the abnormalities that they found, were not significant enough to cause back pain. And so if you have an MRI or an X-ray and there's some abnormalities on there and your doctor's discussing the results in the radiologist report with you, he or she cannot say that is the reason why you hurt. He could say that may be why you hurt, but you can't definitively say that, because there are people walking around who have those same abnormalities and yet don't have any pain. This might also explain why sometimes I have patients come in whose x-rays and MRIs look beautiful. They don't really have very much as far as degeneration or other lesions in their back going on, no particular injury, and yet they're in pain. And what an MRI or an X-ray does not do is take a picture or video of how you move and what's happening in those structures when you move, and therein often lies the problem. You may consider the video blog that I've done on door hinges and that theory as far as where your symptoms may be coming from or what the true source of your problem may be. I'm Benjamin Hill with Mission Physical Therapy.